Hi everyone, it's Dr. Lisa L. Campbell. As I continue to grade your week 2 practicum, I am going to release these little small videos that talk about a particular area of the guidelines. If you have not read the ICD-10-CM guidelines from cover to cover multiple times, now is the time to do so. So for this particular video, I want to focus on neoplasms. So neoplasms, there's a lot of guidelines that you need to contend with. But for this video, I want to focus on the Z51 codes. So let's take a look at those guidelines. Letter E, admissions involving chemotherapy, immunotherapy, and radiation therapy. So when an episode of care involves the surgical removal of a neoplasm, doesn't matter if it's primary or secondary, followed by chemotherapy or radiation therapy during the same episode of care, the neoplasm should be listed first. If we're talking about outpatient, first listed. If you're talking about inpatient, principal. Well, right now we've been focusing on outpatient, and so if care involves the surgical removal of a neoplasm, that neoplasm code should be first. Then there is a guideline that speaks to when the admission or encounter is specifically for chemo, immuno, radiation. Notice it says here in the guidelines, if the admission or encounter is chiefly for the administration of chemo, immuno, external beam radiation therapy, you're going to assign one of those Z51 codes. The guidelines for that particular area, that number 2, ends by saying if the patient receives more than one type of therapy, then you can list them as appropriate, and they can be in any sequence. And then in this particular case, you want to assign the code for the actual cancer. So you see the shift here in one guideline to the next. The first guideline involves the surgical removal of a neoplasm. That's the whole purpose of that encounter, so that neoplasm code goes first. In the second situation, the patient is specifically coming in for the administration of said therapy, so those Z codes would go first, and then the malignancy would go second. What I am seeing is that the patient has cancer, and you all are listing the Z51 as a secondary diagnosis. The Z51 code can only be principal. Let me wrap up this video real quick because I have more to cover. And so I want to go to the Z codes. And I want you to remember, please list your first listed or principal code first. In the guidelines somewhere, and I'll tell you, as you code more, you'll know there's a guideline, but you may not know exactly where it's at. There is a list of Z codes that are to be listed as principal or first listed only. And here it is, number 16. So those codes that I was just talking about, those are to be listed as first listed. And in the particular scenario in week 2, that was not the reason for the patient's encounter, so it should not be listed as a secondary diagnosis. And if a patient is admitted for surgery for that neoplasm and they just happen to have chemotherapy during that stay, you would not use the Z51 because Z51 has to be in the principal. All right.